Hello, my name's Jaweeda Idoo. I'm a GP and I'm also the Clinical Director for Service Transformation, and today I'm going to talk to you about care planning. The aim of today is to support you in understanding on how you as a health and social care professional can actually achieve an aspirational care plan, working with patients, carers and individuals who need to be empowered to manage their condition. Essentially, care planning is a process and a consultation style. It's around empowering individuals to actually take responsibility for their own care. And it's really a culture shift for us as health and social care professionals, because our role then is to support them and empower them to take that responsibility. So the consultation skill set that you need involves 4 processes. The first one is having a discussion with that individual. And during that discussion, you need to understand what their needs are, what their aspirations are, and ask questions like, what matters to you? What's important to you? The next stage of the consultation cycle is to actually look at negotiation. Understanding somebody's needs and aspirations does involve you actually working through how you can deliver and agree with them objectives. To negotiate, firstly, try to understand why they have these needs. So if a patient that I saw a few weeks ago said to me that their need and aspiration is to be more mobile, to be able to walk better, and this is following a substantial stroke, it seemed very clearly to me that that person, having had all their physio, their OT and therapy, were not really going to be able to walk in the way that they hoped they could walk. So the negotiation came to say, well, why do you want to be able to walk better? Why does it matter to you? Why is it important to you? Ask them on a scale of 0 to 10 how important it is, and ask them how confident they are on a scale of 0 to 10 that they can achieve it. And it's around that confidence of 0 to 10 you negotiate. So when the individual said to me, well, a nice lady in her 80s, well, it's because I want to go to Hyde Market, I love shopping, and I meet people and I'm feeling lonely. You understand her need to be mobile is to achieve something important to her, which is around her shopping and meeting people. So the negotiation came with, well, let's discuss some options. And this is where your shared decision making comes in together. You discuss realistic options that they can achieve, discuss the pros and cons of those options, and then agree together what the best approach is. So what we agreed with that lady was, she had an option of maybe using some support from the third sector, like Age UK or volunteer drivers, or she could actually look at family or relatives or friends to see if they can help her go to Hyde Market and support her with her wheelchair. Eventually she decided on it being her niece that would take her to Hyde Market, and when we reviewed her, which is the 4th part of this consultation cycle, the review part, she actually said it didn't work because her niece wasn't available the days that she wanted to go to the market. So we agreed then to go back to the first option around using third sector support and contacting FLAG. Having done that, she is now going to Hyde Market. One of her neighbours, who she likes but doesn't see very often, is going with her, and already the quality of her life is better. And surprisingly, her hospital admissions have reduced considerably. So just to summarise those important 4 cycles of that consultation: have the discussion, understand their needs and aspirations, ask them what matters to them, ask them what's important. Have the conversation around a negotiation and use questions and ratings to understand that, and then come to some shared decision making and remember to review. The 5 skills that really are required to be able to do this include building a rapport, making eye contact with somebody, looking at them, listening to them. That active listening, the second skill, nodding, smiling, and trying to really understand and let them know you're listening is essential. Having good questioning skills is the 3rd set. Questioning skills need to be open-ended, understanding and seeking to understand better and explore options with patients. The 4th skill is motivational interviewing, and that's the thing I discussed earlier, asking people to rate and score how important things are, and how confident they are. And that's the basis of motivational interviewing. And then the fifth skill is around goal setting and action planning. Once you agree a goal with an individual or their carer, what you need to be able to do is apply SMART objectives to it. So what's the goal? When are you going to do it? How are you going to do it? And what the time frame is for achieving that. Once you've got those skill set, and many of you have them already, but there are places, particularly around our e-learning modules available for e-learning for health, where you can practice them. Essentially, using care planning to understand needs and aspirations can reduce dependency on the healthcare system and can improve well-being for patients. It can improve their opportunities as well within a wider health and social care community. So please practice those skills. Remember the documents, the care planning document around aspirational needs is only a document. It's how you apply that consultation style and that skill that helps you remember that the patient and the carer are the asset.